Snoring and sleep apnea, two common conditions that not only cause a lot of sleepless nights, but they can both lead to real health problems. So what can you do? Dr. Craig Schwimmer of the Snoring Center is here to tell us about a treatment you can think of as Lasik for snoring. That's really innovative. How are you, Craig? Good to see you.
Thank you.
There's been a lot of treatments over the years for snoring and sleep apnea. Some work, some are far from perfect. What's new and exciting?
So what I think is really exciting are minimally invasive office-based treatments. And these are tools that allow us, in the office, just using local anesthesia, really to get results that are as effective as traditional surgical therapy. So you get the same upside, but without the risk and the pain and the downtime of traditional surgery.
Oh, we can get rid of all of those things. That's fantastic. And I'm sure that encourages a lot more people who are suffering from sleepless nights, snoring, and sleep apnea to finally seek treatment.
Exactly, because there's not this big hurdle of, hey, I don't want to go through this to treat this condition. It just makes it so much easier for people.
Okay, you brought it with you today, so let's talk about these newer treatments.
So for most people with sleep apnea, we really need to accomplish two things. We need to stiffen the soft palate, which is the roof of the mouth. That's what's flapping around making all the noise.
Oh, okay.
And we need to make it easier for them to breathe through the nose. And surgically, we always did this by going to the operating room and cutting out a bunch of tissue. Now we can accomplish the same thing with two things, one called a pillar procedure to stiffen the soft palate and the other one called turbinate coblation.
Okay, let's talk about the pillar procedure first.
Sure. So this is elegant and has really changed the game of treating sleep apnea with procedures. Pillar procedure takes these little implants and places them inside the soft palate, and really what this is a stitch. And the stitch comes housed inside of this little device. And in the office, using local anesthesia, we take this device and just poke a little hole into the soft palate and then deploy the stitch inside.
And that's what stiffens the palate to stop it from making all of that noise.
Correct. We put a number of these stitches into the soft palate, and then the body over time forms scar tissue around them. And the scar is really what stiffens the palate, decreasing the vibration. But instead of surgically removing a bunch of soft tissue, it's place little stitches inside. Much more elegant, much less invasive, and much less painful.
Okay. Are you awake during this procedure?
Yeah, this is done in the office, local anesthesia, 15 minutes. It really is analogous to Lasik.
Okay. Yeah, because it's really quick and easy.
Right.
And obviously the results are pretty great for something like this. Okay. Well, the other one was turbinate coblation, is that right?
So correct. So the other thing that we need to do is we need to make it easier for people to breathe through the nose. And the turbinate is a structure inside the nose on the side wall. Okay. And the traditional surgical therapy was to go to the OR and cut some of it off. Now we can accomplish the same thing using something called coblation. Okay. And basically this is just a device that uses radio frequency energy. So again, in the office, under a local anesthetic, take the probe, put it inside the nose, use radio frequency energy, and shrink that tissue down. So same outcome, much better for the patient.
Are these done in conjunction with one another?
Yes, most commonly these are done together because most people with sleep apnea do have obstruction at more than one level of the airway. Okay,
so the best thing to do would be probably get the conversation started with your spouse. Sometimes it takes that sleep partner to kind of knock on your and say, we've got to do something about this affecting our quality of life.
And as we've discussed, sleep apnea really is a significant health issue, and it's really important that people treat it.
Okay, and you gave us great reasons to go and seek out that treatment, Dr. Schwimmer. Thank you so much for being here today. And if you want more information, call the Snoring Center. Here's the number, 214-369-2345, or log on to snoringcenter.com. And you can also email Dr. Schwimmer at questions@snoringcenter.com.